Now, today we'll start with gout. Gout is due to excessive production of uric acid. Right? And it is commonly associated with overeating, alcohol consumption, high living, right? And it commonly affect males as compared to females, right? The normal level in males is 3 to 7 milligram percent, and in females is 3 to 6 milligram percent, right? It is 1 milligram percent less in females, but males are more susceptible to gout as compared to females. But post menopausal women are susceptible to gout as well, right? It affects the first metatarsophalangeal joint of great toe, right? Beside this, it can also cause pain in ankles, knee joint, and wrist as well, right? Now we'll start with types of gout. There are basically two types of gout. First is primary gout, and the second is secondary gout, right? And primary gout is associated with purine nucleotide metabolism, maybe due to overproduction of uric acid, right? And secondary gout is due to other reasons that cause increase in uric acid other than purine nucleotide metabolism proper, right? Now we'll start with primary gout in details. Now these are the five enzymes that are associated with primary gout. First is increased activity of phosphoribosyl pyrophosphate synthetase, and second is PRBP glutamyl metotransferase is increased activity as well. These are the first two steps in de novo synthesis. So these are the first two enzymes of the de novo synthesis pathway. And third is HGPRT deficiency, right? Fourth is glucose 6 phosphatase deficiency, right? And the fifth is high activity of glutathione reductase, right? Now I will start with this deficiency first. The fourth enzyme, glucose 6 phosphatase deficiency, it will help you to understand it easily, right? So glucose 6 phosphatase causes breakdown of glucose 6 phosphate to glucose, right? So this pathway, glucose 6 phosphate is converted to glucose by glucose 6 phosphatase, right? So now we have deficiency of glucose 6 phosphatase. So if levels are low, right? So glucose 6 phosphatase will not break down to form glucose. So glucose 6 phosphate will enter HRP shunt because it is the precursor of this pathway, right? So HRP shunt will lead to the synthesis of ribose 5 phosphate, right? Ribose 5 phosphate will ultimately lead to IMP synthesis, and IMP synthesis will cause increase in uric acid production, right? So it's clear, glucose 6 phosphate deficiency, glucose 6 phosphatase breakdowns glucose 6 phosphate to glucose. So in its deficiency, the glucose 6 phosphate will accumulate. The glucose 6 phosphate will enter HRP shunt because it is the precursor for HMP shunt, right? So HRP shunt will proceed and it will lead to the formation of ribose 5-phosphate. Ribose 5-phosphate via de novo synthesis will cause synthesis of IMP, right? From IMP will lead to the synthesis of increased uric acid production. So that clears with glucose 6 phosphatase deficiency. Now we'll discuss these first two enzymes, PRPP synthetase and PRPP glutamyl amidrotransferase, right? So first of all, we have precursor ribose 5-phosphate, right? This converted into phosphoribosyl pyrophosphate. Then it is further converted to 5-phosphoribosyl amine, right? So these are the first two steps, and here this first enzyme is involved, and here this second enzyme is involved, right? So the problem comes when there is increased synthesis of PRPP synthetase. Why? Because it is under feedback control of GDP and ADP, right? But there is variant form of this enzyme under which this tight feedback mechanism is not working, so ultimately leading to increased synthesis of nucleotides, leading to increased synthesis of uric acid, right? Similarly, the second enzyme PRPP glutamyl amidrotransferase, here it is also under good feedback control, but feedback control is not regulated due to increased levels, ultimately leading to the synthesis of increased nucleotide synthesis of purines and ultimately increased synthesis of uric acid, right? Now this third enzyme is HGPRT deficiency, right? It is enzyme of purine salvage pathway, right? So due to deficiency of this enzyme, due to deficiency of this enzyme, hypoxanthine and guanine, right? They cannot be utilized, right? Due to deficiency of hypoxanthine guanine phosphoriboside transferase, right? So this will lead to accumulation of phosphoribosyl pyrophosphate and diversion towards this pathway, ultimately leading to increase purine nucleotides and ultimately leading to increased uric acid production, right? Now the last enzyme is increased activity of glutathione reductase. Its increased activity will cause increase in production of NADP positive, right? And there will be more utilization of HMP shunt. Increase in HMP shunt utilization will result in more formation of ribose 5-phosphate, right? Ribose 5-phosphate will ultimately lead to synthesis of IMP, and IMP will ultimately lead to increased synthesis of uric acid. So all the 5 enzymes are not discussed. Now I will start with secondary gout. The secondary gout is associated with regions that are not directly linked to pre-nucleotide synthesis, right? Now the primary reasons are two C's, right? First is chemotherapy, right? The second C is cancer, right? Cancer can be leukemia, right? Or it can be lymphomas as well, right? And the third reason is psoriasis, right? And the fourth reason is renal failure. So these are the 4 secondary reasons of the gout. Now we'll start with clinical features of the gout. First of all, the confirmatory test, right? The most confirmatory test is you have to aspirate synovial fluid, right? This fluid will contain monosodium urate crystals. This is the most confirmatory test for gout, right? And now coming on to symptoms, the first symptom is it first metatarsophalangeal joint of great toe is affected, causing great pain. It can also affect knee joint, ankle joint, and causes wrist pain as well, right? Now, coming on to the treatment, the primary drug of choice is first is allopurinol, right? Allopurinol causes competitive inhibition and suicidal inhibition of xanthine oxidase, right? Now we'll start with what happens when you have alcohol. Now we'll start with alcohol metabolism because it causes precipitation of symptoms of gout, right? So this is ethanol. Ethanol is metabolized to form acetaldehyde and finally acetic acid, right? So both these steps require NAD and there is synthesis of NADH. So ultimately, when you keep on taking alcohol, the levels of NADH will increase, right? So this causes monosodium urate to get easily converted to uric acid, right? The increased uric acid, because uric acid is less soluble and easily precipitable. So the symptoms of gout will appear, right? There is one other reason due to increased NADH, pyruvate is easily converted to lactate, right? The increase in lactate will cause increase in lactic acidosis, right? So this lactic acidosis will interfere with excretion of uric acid, right? So uric acid will accumulate and whenever the level goes greater than 7 milligram percent, it will precipitate the symptoms of gout. That's why alcohol intake precipitates the attack of gout, right? So that finishes with our gout. So please like the channel and subscribe the channel. Keep on studying. Best wishes. Thanks a lot.